Welcome, everyone. Thank you for tuning into the ICA's Health and Wellness Committee book talk. Today, I am very excited to present to you Breathing Lessons by Dr. MeiLan Han. She is here today to talk with us about this book. Welcome, Dr. Han. In addition to your practice up in Michigan, you are also the spokesperson for the American Lung Association. Is that correct?
Yeah, I wear quite a few different hats. But yes, I'm a spokesperson for the American Lung Association. I also do quite a bit of research in lung diseases as well. So it's nice to be here.
Yeah, thank you so much for joining us. So I really appreciated, to start off, I really appreciated particularly the beginning of this book with all of its explanations, because as someone who was recently caring for a family member who had COPD, who had pulmonary hypertension, who was on oxygen. I wish that I would have found this book earlier because it would have made some of the learning that I needed to do so much easier. But hopefully we'll talk obviously about how we can relate your book to playing the clarinet, but for anyone out there who may have to care for a loved one, hopefully that will make your learning curve a little less steep as well. I found your explanations to be very informative, but also very readable. And I bet that you were really working for that. How hard is it to make it something that is easily accessible when you're so steeped in all of the medical terminology?
Yeah, it's funny. My son, who's 12, was recently, he kind of noticed a lot of my medical writing. He thought, how in the world did you learn all that? Because it is almost like learning a second language, but then you forgot what it was like to not know. But you're right. Actually, in thinking about writing the book, I really was trying to channel all the conversations I've had with patients in my roughly 20 years of practice, and how I really try to get in their heads and kind of in the book just mirror some of those very simple conversations. And even some of believe it or not, the drawings started out as hand drawings that I drew. So I was thinking about the pictures that I draw for patients in the office, of understanding just how the blood flows and where things go and how things can get messed up. And so I just tried to translate those conversations and translate even the pictures that I would draw for patients into something that would be a little bit longer lasting and could hopefully reach more people than just the people in my office.
Yeah. Well, and like I said, it's a very easy read. If any of you are wanting to get into more the mechanics of how your respiratory system functions, it's not as daunting a task with this book as it otherwise might seem. We obviously spend a lot of time in clarinet world discussing breathing and discussing how to maximize our efficiency, how to make the air move most efficiently from the oral chamber through the instrument. But at the source, we don't talk a lot about it, and I feel like we only really discuss things when there's a problem that then comes up, and how do I address it. And so one of the things that you talk about is the elasticity of the lungs themselves. We talk about, the diaphragm, its work in pulling air and expelling air, but the walls of the lungs actually having their own measure of elasticity is something that a lot of people might not really know, they might not really realize.
Yeah, it's interesting. So that conversation specifically is in the book, in part because the book stemmed from an episode I did of Freakonomics. So if anyone's curious, you can also check out, which I still think of as a radio show, but I think it's technically a podcast now. I'm not sure which. But the question, the reason I had done that original Freakonomics podcast, which was during the pandemic, was people needed, a lot of people were going on mechanical ventilators, and people were trying to understand, what is a ventilator? Why do we need it? Why is it different than the way we normally breathe? And so I kind of had to go into this discussion of how we normally breathe and how being on a ventilator is different. And it very much relates to the question you have. So maybe I'll start with that. So one of the things people don't realize is that the lung and the mechanics around the lung, including the diaphragm and the chest wall, can almost be thought of like as a rubber band. And there are constant forces kind of pulling it out, a constant forces pulling it in, and there's this like resting tension place that we kind of sit at. And the diaphragms kind of actually sit in a more relaxed position. And then when they fire, air is pulled in, and then when they relax, air comes out. When we try to kind of force the breath out, as you would for a wind instrument, it's going to be a combination of the diaphragms relaxing, plus a lot of those kind of external muscles, plus the lungs' internal elasticity that are going to allow that air to kind of be pushed out in a more forceful way. But there are a whole host of things that can mess up that kind of natural resting place, which will make getting air in and out more difficult, and hence playing the clarinet more difficult. We have what we call obstructive lung diseases, which are things like asthma and COPD. And what happens there is the lung gets to be too big. And so if the lung gets to be too big, the diaphragm is normally, it gets more flattened. And then the lung's resting position is too big. And when you go to flatten the diaphragm and kind of fire the breath to come in, there's no room for the lung to go. And so, and then also as you try to push the air out due to multiple things that can cause obstruction, including narrowing of the airways or loss of elasticity in the lung from things like emphysema that would cause early airway closure. And then you don't get that forceful exhalation. So that's one problem. A different problem we have are things we call sort of fibrotic lung diseases or interstitial lung diseases. And in those, you can think of the rubber band as being too tight. And so the lung is kind of shrunken in on itself. And in both conditions, sometimes the oxygen exchange isn't good. But then, trying to pull the air in, you're not going to be able to get it even to a full opening. And then, so there's less air to then push out. So both can be problematic.
Yeah. And especially when we're talking about a wind instrument. Understandably, there's the concern, about being able to inhale well, being able to exhale well, being able to avoid the things that might damage the lungs, which you go into in pretty wide detail in your book. Like, here are all of the things that you might need to consider, you might need to avoid. But musicians tend to be pretty proactive. Like, what can I do to improve? What can I do to maximize? And so is there anything that we can proactively do to probably just maintain that elasticity?
It's really, I would say, a balance between trying to play defense and a little bit of offense. So the defense is there's just, if you think about it, like there's just stuff constantly bombarding the lungs. And unlike, like, we get our hands dirty, right, all the time, whether it's washing dishes, the garden, painting, whatever it is. But you can usually see where the problem is immediately, and then you can wash, right? And you have a general sense of how much, damage was done and how clean you got it afterwards.
Yeah,
Problem
but how do you?
right. We don't see it, we don't think about it, we have no idea. One of the most interesting pieces of research for me that came out of the COVID pandemic was that in the American Northwest, when there were a lot of wildfires in the first summer of the pandemic, saw an increased number of COVID cases and COVID deaths when people were simultaneously exposed to air pollution from the wildfires. And I'm sure that none of those people, I mean, I'm sure it was irritating, but they probably weren't consciously thinking or consciously aware that they were having small amounts of lung inflammation that was causing some damage that then made them more susceptible to other things like infections. And we're even understanding that even in kind of reasonably healthy young adults with normal lung function, even things like tobacco exposure in combination with a respiratory virus can actually cause accelerated lung function decline. So there's just all sorts of things. And so I kind of when I think about when I think about lung health, I think about kind of the whole lifespan, but I'm going to assume most of the people on this call are adults. So there's probably not much you can do about anything, protecting yourself up until that point. But I think just being sort of more conscious and aware of maybe not going out on high air pollution days, thinking about air pollution in the home, trying to keep things like wood burning stoves and I mean, I still have natural gas in the home, but there's a lot of things, radon, VOCs, et cetera. And there's some stuff in the book about like how to reduce exposures, air filters, if it's a high air pollution day, some things like that. If you're gonna I can't tell you the number of people who've come in who've picked up something after like cleaning out a dusty basement or a dusty garage. Just like think about it. Don't like start kicking up dust or and then take a big whiff. So like now if I'm going to be cleaning something nasty that I know is going to kick up dust, we all have mess sitting around, I'll just throw one on. And because you can't really wash afterwards. You got to think about putting those gloves on at a time. And then in terms of I try to pay attention to what my doctor tells me about respiratory vaccines, and I try to really kind of hound that in. That's a protective thing you can do. But one other thing you can do, which is kind of more in that offensive bucket, there is some reasonable data on exercise. And not necessarily just breathing exercises, but aerobic body exercise. And there's a study that shows that for people who had the highest baseline fitness levels as young adults, and if you could maintain or even improve your aerobic fitness levels during adulthood, those are the people that had the best lung function later in life.
Oh, that's good to know.
And so we don't 100% know why that is. One option is, breathing isn't just about the lungs and it isn't just about the diaphragms. It's also all of the accessory muscles that, it's your, rib cage and there's, the shoulder girdle. There's a lot of muscles in here.
Uh-huh.
One thought is, if you're just exercising, generally speaking, you're going to be more fit and able to, maximize your lung function. That's one thought. But there is another school of thought that thinks it's possible that exercise actually has an anti-inflammatory effect. And that maybe we talked about like subtle exposures and things like that, viruses, there's probably more going on to inflame your lungs on a general basis than we kind of are all realizing. And that, just that positive effect of exercise may have this kind of long-term anti-inflammatory effect. We know it's protective for cardiac health. The other thing that I like about aerobic exercise is that it forces, of course, clarinet players, it's probably not as much of an issue, but maybe for the general public, forces you to take usually a bigger breath. And sometimes mucus and stuff kind of like in some patients will kind of accumulate in lung bases or even in the back. And when you're taking those bigger deep breaths, it really just kind of helps with clearance of the lungs, generally speaking, and which helps to lower risk for infection and things like that.
Okay. Well, and it kind of makes sense too, being that the respiratory system is so closely linked with the circulatory system, that if you are improving your circulation with exercise, that would have a bearing on your breathing as well. Yeah, that kind of makes sense. So you just kind of answered another question that I had jotted down when you were talking about inflammation and the use of the lungs. I was going to ask if we are experiencing some sort of, let's say, a viral infection, and so there is maybe some inflammation in the lungs. Is it probably better for us to rest the lungs, or is it probably okay for us to continue to play?
Oh, you mean like if you've got a cold, should you play?
Sure. I
I'll
know, that's
admit,
a good one.
I don't know that I have a good answer for that because I don't actually know. So I'm gonna have to try to like wildly.
Kind of like walk through that. That was a hard question. I just kind of threw at you. Sorry.
Depends on the severity of the infection. Like
Okay.
we know that like if patients end up on a mechanical ventilator and we're forcing air into the lungs, so it's a very different kind of breathing. That's positive
Uh-huh.
pressure as opposed to negative pressure breathing.
Uh-huh.
If we're like actively forcing air into the lungs during a time when patients are vulnerable and they have pneumonia infection, it can actually be harmful. But I don't know that I can completely extrapolate to kind of stand under standard breathing conditions and milder infections. I would have to, I think, I feel like I'm like on Jeopardy or something like that.
No, that's fine.
Like I would have to just guess that you should just go with common sense. So if it hurts or it's uncomfortable, probably not.
Okay.
Probably want to rest. But if it's just kind of mild and slightly irritating, it's probably fine. I think that one thing, regardless, so I don't know that you want to stress the lungs unnecessarily. One thing that's worse is when we have people who are sick and then they just totally like stay in bed and aren't taking good deep breaths. Now, obviously, there's sometimes you're so sick, yes, you have to stay in bed. But
Yeah.
generally speaking, the sooner you can kind of get up and start taking at least normal breathing, you're going to help to kind of clear things out faster.
Mm, yeah. Yeah, because like I think most of us have had the experience of having a cold and we can't necessarily just take off work because it's a cold, right? But in the practice room, maybe taking that deep breath will elicit, a little fit of coughing. And on the one hand, it's like better out than in. But
Yeah.
on the other hand, yeah, that makes sense that it's like if you are so not well that it is like a struggle, then maybe
Yeah, then
that's a good
probably
time to take a rest.
take rest. Yes.
Yeah, don't try to push through it. Just
Right.
give yourself a break. Yeah. Okay. Thank you. So those of us that teach, we spend some measure of time with our students teaching longevity of breath.
Hmm.
And I've always heard that you can increase your lung capacity only up till about the age of 25 or so when your body really is done growing. And then after that, it's more just making efficient use. Is that actually true?
Well, the lungs stop growing around 25. So, from that perspective, yes, it is true. When we measure people over the average population over a lifetime, peak lung function is usually hit at 25. And then after that, unfortunately, we all lose lung function with age
Okay.
due to probably a certain amount of small airways disease creeping in and probably a little bit of loss of elasticity over time. So so I would say that's generally true. And the interesting thing is, I have a choir singer who's one of my patients, and their lung function has always looked a little super normal. And I think there's this story kind of going around that, wind players and singers have higher than normal lung function to begin with. But I think the data on that's a little mixed as to whether that's actually true or not. So I would say I would probably concur with your statement.
And yeah, maybe it's that perception just because we use it more in a very deliberate way than maybe most people do. And so the perception is that we have better lung function, but that might not actually
Well, there
be
are
the
different aspects of lung function too, right? So there's the total amount of air you can get in
uh-huh.
and that's what we call total lung capacity, and that's what kind of maxes out. But there could be differences, and I'll admit, haven't seen any data on this. I didn't think to look it up, probably should have. But how quickly you can get that air out, or how well controlled you can get that air out, and that I could imagine could definitely differ based on other factors. Certainly, if you've got any airway inflammation or kind of anything wrong, that's going to slow that process down and make that harder.
Yeah. Well, and in our case too, we're playing into resistance. We're exhaling into all of us who play wind instruments, even flute players. Their embouchure is not completely dissimilar from the pursed lip breathing that, we
Mhm,
had to do
mhm.
with my relative that we were taking
Yeah.
care of. It offers its own little bit of resistance.
Yep.
So even if it's not like you're blowing into a mouthpiece or buzzing into a mouthpiece, there's still that little bit of resistance. Whereas singers, maybe not so much. That might be a little bit of a different case. So to go back, I'm sorry to step back again into inflammation in the lungs, asthma. Most of us, again, who teach have encountered students who have asthma. And anecdotally, I've heard that playing a wind instrument can actually help with that, can actually improve that. But again, I'm curious, how true is that?
It's a good question. So, for patients with obstructive lung disease, you mentioned that we'll sometimes use pursed lip breathing, a little bit more in COPD than asthma. But the reason we do that is because if you get early small airway closure due to inflammation or problems with lung elasticity, that little bit of back pressure that's caused by that will help to keep the airways open longer and actually allow for more full exhalation. So that is one of the reasons why we suggest it. Um, there is kind of differing opinions and kind of weaker data as to whether kind of strength training is helpful. We at our rehab here in Michigan actually have a harmonica players club. We've had one for
That's
years.
terrific.
And I'm not sure, to be honest, whether the benefit is more social or it is that, we're actually, but the data would suggest that it probably you don't need to focus on diaphragm strengthening exercises, specifically breathing out against resistance, unless in some cases where there's an actual weakness.
Okay.
And I think in asthma, it's a little less likely. In COPD, as people get older, there might be more reasons why there would be weakness. So it's not 100% clear that the strengthening aspect necessarily helps, because I think there's unlikely to be intrinsic weaknesses in that patient population usually.
Mm-hmm.
Maybe there's a little bit of help with kind of clearing out some of the smaller airways or opening up some, maybe, but I'm really kind of
Yeah.
conjecturing here. But honestly, if somebody enjoys it and they're having fun with it, I certainly don't think it's bad.
Okay. So on the flip side of that, it's probably not a detriment, even if it's not clearly a benefit. That's fair. That's fair. There's a lot you talk about this in your book as well, that it's I found it surprising how little there is a body of research around the respiratory system. Like, we don't have as clear an understanding of all of the parts of it as maybe we do with some others. Like, it's just not something that we've spent a lot of time, we collectively have spent a lot of time on. And I
Well,
find that fascinating.
there's definitely a lot of, research. I do research on the lung, but
Sure.
I would say maybe compared to some other fields like cardiology, there's been less investment, central investment,
Yeah.
from like the National Institutes of Health, et cetera. We've just had kind of smaller budgets. There's also been like just less investment in some of these really long longitudinal studies, which are really helpful. But for kind of like trying to answer this question of like when exactly does lung function peak and
Sure.
when does it get worse? I think it's also a little bit it's just kind of a tricky organ to study, and I also think we just haven't talked about it as much in sort of the public, like we have diabetes and cardiac disease, where I think people have this really good understanding, which is honestly why I wrote the book, because in the middle of the COVID pandemic, maybe not now, but in the middle of the COVID pandemic, a lot of people were all of a sudden needing to understand how the lungs work, what happens
Right.
when things go wrong. What I would argue is that I think with a lot of the stuff we have going on, with worsening of air quality, um, new viruses, I feel like popping up every day. I think that those kind of some of the concerns, though, despite it sort of being in the back of our minds because of us kind of coming out of the backside of the pandemic, I think some of the concern though should still be there and is more relevant. In fact, in the medical school at the University of Michigan, I am now teaching a course, which I never, teaching class, which I never had exposure to as a, trainee on just trying to understand sort of the general threats to lung health that aren't the traditional things that we learn about in medical school. So I think it's something that we need to work on increasing awareness of, not just in patients, but also, some of our budding physicians. I'm afraid I'm getting a little tight on time. So
Okay.
do you want to have like a final question?
I'm gonna ask one more that is pertinent to a few people that found out that I was going to be working with you. I really would like to do the one about injuries, but
Sure.
the one about altitude came up a couple of times. So
Okay.
if I am a musician here in the Midwest, United States, and let's say that I just get lucky enough to go to Aspen
Sure.
for a music festival. That's quite a shift.
Yes.
And is there anything that we can do to kind of prepare ourselves for that kind of change in elevation to make it easier for us to breathe?
So it's not that the mechanics of breathing are really any different at altitude. The problem is the lower amounts of oxygen. And so as your body tries to compensate for the lower amounts of oxygen, it tends to breathe faster. But the problem with that is that the lungs do two things. They take oxygen in and they blow out carbon dioxide. And carbon dioxide also acts in the lungs, or sorry, in the bloodstream as an acid base buffer. And so you end up shifting the acid base balance in your blood, and you can feel sick. And so that's why, we talk about things like high altitude sickness. It takes a couple of days for your kidneys to kind of catch up. So things that you can do that help a little bit are going to be, I always try to get a humidifier in my room. If I'm staying at a hotel, for instance, honestly, I'm not 100% sure why that helps, but I'm convinced that it does. And if it's a huge issue for you, you actually can get some medication from your doctor called Diamox, which will help restore the acid base balance a little bit faster. The other thing is the air tends to be drier. Well, that's, yeah, relates to humidity. You want to just try to stay as hydrated as possible to get yourself through that first couple of days. It's not uncommon to experience headaches and things. So it's not really so much that there's any change in your respiratory capacity per se, but you're gonna feel like things are different just again because the air is thinner.
Sure. Yeah. Okay. Well, I thank you very much for your time. And again, it was an excellent book to read. I really enjoyed it. I found it very informative, and if not for the mechanics of playing the instrument, for again that root, cause that root source of our respiratory system. This was excellent. Thank you very much for joining us.
Well, thank you for having me. If you have any other follow-up questions, you can always shoot me an email and I can try to answer them that way.
Will do. Will do.
All right.
Well, thanks
Thank
so
you.
much.
Nice to meet you.